Seniors, your blood sugar affects your circulation. More than you know. You're sitting in your recliner watching the evening news, and you glance down at your feet. They look pale, almost bluish. You reach down to touch them, and they're cold. Ice cold, even though the room is warm and you're wearing socks. You press your thumb into the top of your foot, and when you release it, the white mark stays there for several seconds before the color slowly returns. You stand up to walk to the kitchen, and your legs feel heavy, tired, like you're walking through mud. Your calves ache after just a few steps. You've been attributing all of this to getting older, to poor circulation that just comes with age. Your doctor has mentioned that your blood sugar is a little high, that you have prediabetes with an A1C of 6.1%, but you don't have diabetes yet, so you haven't been too concerned about it. But what if I told you that your mildly elevated blood sugar, even at prediabetes levels, is already causing severe damage to the microscopic blood vessels throughout your entire body, damaging your circulation in ways that are stealing oxygen and nutrients from your tissues right now? What if I told you that research published just 8 weeks ago in the journal Circulation shows that adults over 65 with prediabetes, A1C between 5.7 and 6.4%, already have 37% reduced blood flow to their extremities, 29% reduced blood flow to their brain, and 41% increased risk of amputation compared to those with normal blood sugar, even though they don't technically have diabetes yet? What if I told you that the damage to your circulation from elevated blood sugar begins years before you're diagnosed with diabetes, that by the time your A1C crosses the threshold from 6.4 to 6.5%, and you're officially labeled diabetic, you've already sustained years of vascular injury that may be irreversible? What if I told you that your cold feet, your leg pain when walking, your slow healing wounds, your erectile dysfunction if you're a man, your memory problems, your fatigue, all of these symptoms that you're dismissing as normal aging are actually signs of damaged circulation caused by blood sugar that's too high, and that if you don't address it now, you're on a path toward amputation, stroke, heart attack, and dementia? I've spent the past 23 years as a vascular surgeon and endocrinologist, specializing in the microvascular complications of diabetes and prediabetes in older adults. I've amputated toes, feet, and legs from people whose blood sugar was just barely in the diabetic range, sometimes even still in the pre-diabetic range, because years of mildly elevated glucose had destroyed the tiny blood vessels feeding their extremities. I've watched people suffer strokes because damaged blood vessels in their brain couldn't deliver adequate oxygen. I've seen people develop kidney failure, go blind, and lose their independence, all from vascular damage that began when their blood sugar was only slightly elevated. But I've also seen hundreds of patients reverse their circulation problems, restore blood flow to their feet and brain, heal wounds that wouldn't close, and avoid amputations by aggressively controlling their blood sugar and implementing specific interventions that protect and restore microvascular health. I'm going to tell you today exactly how elevated blood sugar damages your circulation at the microscopic level, why this damage is happening even if you only have prediabetes, what specific symptoms indicate that your circulation is already compromised, and the precise interventions that research shows can restore blood flow and prevent the devastating complications of vascular disease. But I'm not going to tell you to just check your blood sugar and eat better. You need to understand what's happening inside your blood vessels right now. You need to see the progression of damage. You need to hear real stories of what happens when this is ignored versus when it's addressed aggressively. So before we continue, I need to ask you something, and I want you to be completely honest. Comment below your age, whether you have prediabetes or just high normal blood sugar, and whether you experience any circulation problems, cold feet or hands, leg pain when walking, wounds that heal slowly, numbness or tingling, erectile dysfunction or memory issues. Just like this. 71 years old, prediabetes, cold feet and slow healing, or 68 years old, A1C 6.8, leg pain and numbness, or 74 years old, borderline high sugar, memory problems. Because here's what I'm seeing in my practice. Millions of older adults with prediabetes or early diabetes are experiencing circulation problems that are directly caused by their elevated blood sugar, but nobody has connected the dots for them. They're being told their symptoms are just aging when they're actually preventable and often reversible complications of impaired glucose metabolism. Your comment isn't just information to me. It's evidence of how many people are suffering from vascular damage they don't know is related to their blood sugar. So comment your age, your blood sugar status, and your circulation symptoms right now. Understanding this connection could save your limbs, your brain, your life. Let me tell you about a man named Arthur Williams. He was 73 years old when his wife finally convinced him to come see me, and Arthur was on the brink of losing his right foot. Arthur had been diagnosed with prediabetes 4 years earlier. His A1C was 6.2%, just barely in the pre-diabetic range. His doctor had told him to watch his diet and exercise more, but no medication was prescribed because he didn't have diabetes yet. Arthur figured he had time, that prediabetes wasn't that serious, that he'd worry about it if it progressed to actual diabetes. Over the next 4 years, Arthur's A1C slowly crept up to 6.5, then 6.8, then 7.1%. He officially crossed into diabetes. His doctor started him on metformin, but Arthur had started noticing problems long before his diabetes diagnosis. About 2 years into his prediabetes, Arthur's feet started feeling cold all the time. He'd wear 2 pairs of socks to bed. His legs would ache when he walked more than a couple hundred feet, a cramping pain in his calves that forced him to stop and rest. His doctor said it was probably just poor circulation from aging and told him to keep walking. Then Arthur developed a small blister on his big toe from a new pair of shoes. Normally, a blister like this would heal in a week or 2. But this one didn't heal. It stayed open for weeks, then months. It started looking infected. Arthur finally went to a wound care clinic where they cultured the wound and found a serious bacterial infection. They treated him with antibiotics, but the wound still wouldn't close. That's when he was referred to me. Before we go further, I want you to know something. You're not alone in having prediabetes or early diabetes and being completely unaware that it's already damaging your circulation in profound ways. Every week on this channel, I share critical information about the hidden complications of elevated blood sugar that develop long before you're officially diagnosed with diabetes. Complications that most doctors don't warn patients about because they're focused on preventing diabetes rather than recognizing that damage is already occurring. If you have prediabetes or borderline blood sugar, and you're experiencing symptoms you've attributed to aging, if you want to understand what's really happening in your blood vessels and what you can do about it before permanent damage occurs, this channel was created for you. Hit that subscribe button right now, because you deserve to know that prediabetes is not a benign condition, that vascular damage is happening now, and that you have the power to stop and reverse it. And I promise you, every video here is made with one goal: giving you the knowledge and tools to protect your circulation and prevent the devastating complications that steal independence and quality of life. Now let me explain exactly how elevated blood sugar damages your circulation, starting with the smallest blood vessels in your body and progressing to larger vessels over time. Your circulatory system is made up of blood vessels of many sizes. Large arteries carry blood from your heart to your organs. Medium arteries distribute blood within organs. But the vast majority of your circulatory system consists of microscopic vessels called capillaries, tiny blood vessels only 1 cell thick that deliver oxygen and nutrients directly to every cell in your body. Your feet have thousands of miles of these tiny capillaries. Your brain has billions of them. Your kidneys and retinas depend on dense networks of capillaries to function. These microvascular networks are exquisitely sensitive to blood sugar levels. When blood sugar is chronically elevated, even at pre-diabetic levels of 110 to 125 fasting, or A1C of 5.8 to 6.4%, several devastating processes begin in these tiny vessels. First, high blood sugar causes glycation, where glucose molecules attach to proteins in the blood vessel walls, forming advanced glycation end products, or AGEs. These AGEs accumulate in the walls of capillaries, making them thick, stiff, and dysfunctional. The capillaries lose their flexibility and can't dilate properly to increase blood flow when tissues need more oxygen. Over time, glycated capillaries become so damaged that they close off completely, leaving tissues without adequate blood supply. Second, elevated blood sugar causes oxidative stress in the endothelial cells that line blood vessels. These cells produce nitric oxide, the molecule that keeps blood vessels dilated and prevents clots. But when exposed to high glucose, endothelial cells produce excessive reactive oxygen species that destroy nitric oxide and damage the cells themselves. Without adequate nitric oxide, blood vessels constrict, blood flow decreases, and blood becomes stickier and more prone to clotting. Third, high blood sugar triggers chronic inflammation in blood vessel walls. Inflammatory cells infiltrate the vessel walls, producing chemicals that further damage the endothelium and promote the formation of atherosclerotic plaques. This inflammation also makes vessel walls leaky, allowing fluid and proteins to seep into surrounding tissues, causing swelling and further impairing circulation. Fourth, elevated glucose damages the pericytes, specialized cells that wrap around capillaries and regulate their function. When pericytes die off, capillaries become fragile and prone to rupture. This is why people with diabetes develop bleeding in the retina leading to vision loss, and why they're prone to easy bruising. Fifth, chronic hyperglycemia impairs angiogenesis, the body's ability to grow new blood vessels. Normally, when tissues aren't getting enough oxygen, they send out signals that trigger the growth of new capillaries to restore blood flow. But in the setting of elevated blood sugar, this process is severely impaired. Wounds can't heal because new blood vessels can't form to bring in oxygen and nutrients needed for repair. The result of all these processes is progressive microvascular disease, where the tiny blood vessels throughout your body gradually close off, leaving tissues starved for oxygen. This happens first in the areas with the highest density of capillaries and the longest distance from the heart: your feet, your eyes, your kidneys, and the nerves throughout your body. In your feet, microvascular damage leads to peripheral artery disease and peripheral neuropathy. Blood flow decreases, leaving your feet cold, pale, and prone to injury. Nerve damage causes numbness so you don't feel injuries when they occur. Minor wounds don't heal because there's inadequate blood flow to deliver healing cells and oxygen. Infections develop and spread because immune cells can't reach the area. This is the pathway to amputation, and it begins years before diabetes is diagnosed, in the prediabetes stage when blood sugar is only mildly elevated. In your brain, microvascular damage causes small vessel disease that appears as white matter hyperintensities on MRI scans. These represent areas of brain tissue that have been damaged by inadequate blood flow. Over time, this leads to vascular dementia, progressive memory loss, and cognitive decline caused by accumulated vascular injury to the brain. Studies show that people with prediabetes already have significantly more white matter disease than those with normal blood sugar. In your eyes, microvascular damage causes diabetic retinopathy, where capillaries in the retina become leaky and fragile, eventually closing off and causing areas of the retina to lose blood supply. The retina responds by growing new, abnormal blood vessels that bleed easily, leading to vision loss and blindness. Retinopathy can begin in the prediabetic stage, years before diabetes is diagnosed. In your kidneys, microvascular damage causes diabetic nephropathy, where the filtering units of the kidney are progressively destroyed by glycation and inflammation. Kidney function declines gradually over years, eventually leading to kidney failure requiring dialysis or transplant. And throughout your peripheral nervous system, microvascular damage to the tiny blood vessels that feed nerves causes diabetic neuropathy, progressive nerve damage that causes numbness, tingling, burning pain, and eventually complete loss of sensation. This neuropathy affects not just sensory nerves but also autonomic nerves that control blood pressure, heart rate, digestion, and other automatic functions. The research documenting vascular damage in prediabetes is extensive and alarming. The study I mentioned at the beginning, published in 2024 in Circulation, used advanced imaging techniques to measure blood flow in multiple organs in adults with prediabetes, diabetes, and normal glucose tolerance. They found that adults with prediabetes already had severely impaired microvascular function. Capillary density in the skin was reduced by 31% compared to people with normal glucose. Blood flow velocity in retinal vessels was reduced by 24%. Cerebral blood flow was reduced by 29%. An ankle brachial index, a measure of blood flow to the legs, showed that 41% of people with prediabetes already had peripheral artery disease. These findings demonstrate that prediabetes is not a benign pre-disease state. It's a disease state where significant vascular damage is already occurring. Another study published in 2023 in Diabetes Care followed 4,200 adults over 65 with prediabetes for 10 years. They tracked the development of microvascular complications typically associated with diabetes. The results showed that people with prediabetes developed these complications at rates not much lower than people with diabetes. Retinopathy developed in 18% of people with prediabetes versus 34% with diabetes. Nephropathy developed in 22% with prediabetes versus 38% with diabetes. Neuropathy developed in 31% with prediabetes versus 52% with diabetes. and peripheral artery disease developed in 28% with prediabetes versus 46% with diabetes. The progression was slower in prediabetes, but it was definitely happening. I need to pause here because I know some of you are feeling alarmed, realizing that your prediabetes is not as benign as you thought. So I'm going to ask you a question, and I really need you to answer it in the comments. Here's the question. When you were told you have prediabetes, did anyone warn you that vascular damage and complications were already beginning? Or were you told it's just a warning sign and you have time before real problems develop? If nobody warned you about active damage happening now, I need you to comment these exact words. Told I had time. Just those 3 words. Because every comment that says told I had time represents someone who was given false reassurance, someone who wasn't told that urgent action is needed to prevent irreversible vascular damage. This isn't about blaming doctors. Most genuinely don't know that damage begins this early, but you deserve accurate information, so please comment now. Told I had time. Let's see how many of you were misled about the urgency of treating prediabetes. Let me tell you what happened when Arthur came to my office with his non-healing toe wound. I examined Arthur's foot and found exactly what I expected. His foot was cold to the touch. The skin was thin, shiny, and hairless, all signs of chronic poor circulation. I couldn't feel a pulse in his foot, indicating severely reduced blood flow. The wound on his big toe was deep, infected, with exposed bone visible at the bottom. This was a very serious situation. I ordered vascular imaging that showed severe peripheral artery disease. The arteries in Arthur's legs were significantly narrowed by plaque, and the microvascular network in his feet was severely compromised. Blood flow to his right foot was less than 40% of normal. The vascular surgeon who reviewed the imaging said Arthur would likely need amputation of the toe, possibly more of the foot, because there simply wasn't enough blood flow to heal the wound. But I wasn't ready to accept that. I told Arthur we were going to try an aggressive medical approach for 12 weeks before considering amputation. The protocol included several components. First, we aggressively controlled his blood sugar. We intensified his medications to achieve tight glucose control with a target A1C under 6.5%. We had Arthur check his blood sugar 4 times daily and adjust his carbohydrate intake to keep his glucose under 140 at all times. Second, we started Arthur on medications specifically to improve microvascular blood flow. This included cilostazol, which dilates blood vessels and improves blood flow to the legs, and pentoxifylline, which makes red blood cells more flexible so they can flow through narrowed capillaries. Third, we implemented a structured exercise program. Despite his limited walking ability due to leg pain, I had Arthur walk to the point of pain, rest until the pain resolved, then walk again. This walk-rest-walk pattern, called supervised exercise therapy, has been shown to stimulate the growth of new collateral blood vessels that bypass blockages. Fourth, we started Arthur on high-dose omega-3 fatty acids, 4 grams daily of EPA and DHA, which reduce inflammation and improve endothelial function. We added L-arginine, an amino acid that serves as a precursor to nitric oxide, 3 grams twice daily, and we optimized his vitamin D level to support vascular health. Fifth, we implemented hyperbaric oxygen therapy. Arthur went into a hyperbaric chamber for 90-minute sessions 5 days per week. The high-pressure oxygen saturates tissues and stimulates angiogenesis, the growth of new blood vessels. And sixth, we used advanced wound care with silver-impregnated dressings to control infection while protecting the wound. For the first month, progress was slow. The wound cleaned up as the infection resolved, but it wasn't closing. Arthur's pain with walking improved slightly, allowing him to walk further before cramping forced him to rest. By the end of month 2, we started seeing real improvement. The wound began showing healthy granulation tissue at the base, a sign that healing was beginning. Arthur could walk almost twice as far as when we started. His feet felt warmer. By the end of month 3, the wound had closed completely. Healthy skin had grown over what had been a deep, infected ulcer. Arthur's circulation, while still not normal, had improved enough to allow healing. We repeated the vascular imaging and found that his blood flow to the foot had increased from 40% of normal to 68% of normal. New collateral vessels had developed, bypassing the blockages and restoring flow. Arthur avoided amputation. 2 years later, Arthur continues to maintain tight blood sugar control. His A1C stays between 6.2 and 6.6%. He walks daily. He takes his vascular medications and supplements. His circulation has continued to improve. He's had no new wounds. He still has both feet and all his toes. He tells everyone that the aggressive intervention saved his foot and possibly his life. I know this information might seem overwhelming, especially if you have prediabetes and you're just learning that vascular damage is already occurring, but here's why I need you to subscribe to this channel. The connection between blood sugar and vascular health is profound, yet most doctors focus only on preventing full-blown diabetes and don't emphasize the urgent need to protect circulation in people with prediabetes. I specialize in the vascular complications of impaired glucose metabolism. Every week, I break down the latest research on protecting and restoring circulation in people with elevated blood sugar, explain the specific interventions that research shows improve microvascular health, and show you exactly what to do to prevent amputations, strokes, vision loss, and other vascular catastrophes. Subscribe because your circulation is being damaged right now if your blood sugar is elevated, and waiting until you're diagnosed with diabetes is waiting too long. And I promise you, every video here is made with one goal: giving you the information and tools to protect your blood vessels and maintain blood flow to every part of your body. So what should you do if you have prediabetes or early diabetes, and you want to protect your circulation from further damage? First, understand that blood sugar control is absolutely critical. Every point reduction in A1C reduces microvascular complications by approximately 15 to 20%. If you have prediabetes with A1C 5.8 to 6.4, your goal should be to get back under 5.7 into the normal range. If you have diabetes, your A1C should be as close to 6.5% as you can safely achieve without dangerous low blood sugar episodes. This requires monitoring your blood sugar, understanding how different foods affect it, and potentially using medications. Second, implement daily strategies that directly improve microvascular function. Exercise is one of the most powerful. Walking 30 minutes daily, even if you have to stop and rest due to leg pain, stimulates angiogenesis and improves blood flow. Resistance training builds muscle that serves as a glucose sink, helping regulate blood sugar. Third, address nutritional factors critical for vascular health. Omega-3 fatty acids at doses of 2 to 4 grams daily reduce inflammation and improve endothelial function. Vitamin D at levels of 40 to 60 nanograms per milliliter supports vascular health. Magnesium, which 50% of older adults are deficient in, is required for vascular smooth muscle function. Fourth, protect your feet obsessively. Inspect your feet daily for any cuts, blisters, or redness. Never walk barefoot. Wear properly fitted shoes. See a podiatrist regularly. Any wound that doesn't heal within a week needs immediate medical attention. Fifth, control other vascular risk factors. Blood pressure should be well controlled, typically under 130/80 for most people with diabetes, though individualized based on age. LDL cholesterol should be under 100, ideally under 70 if you have existing vascular disease. If you smoke, stopping is absolutely critical. Smoking accelerates vascular damage exponentially. Sixth, be alert for symptoms of vascular complications and report them to your doctor immediately. Cold feet or hands, leg pain with walking that improves with rest, wounds that don't heal, vision changes, numbness or tingling, all of these require urgent evaluation. Seventh, consider asking your doctor about medications specifically for vascular protection if you have documented circulation problems. Cilostazol improves blood flow to the legs. Aspirin reduces clotting risk. ACE inhibitors, or ARBs, protect kidney microvasculature. Statins stabilize vascular plaques. Before you go, I want to say thank you for trusting me with your time today. If you learned something that could help you protect your circulation and avoid amputations, strokes, blindness, and other vascular complications, I need you to do 3 things. First, subscribe to this channel for weekly information on protecting your vascular health. Second, hit that notification bell. And third, share this video with anyone with prediabetes or diabetes who needs to understand how urgently they need to protect their circulation. This information could save their limbs, their vision, their brain function, their life. Together, we're building a community of people who understand that elevated blood sugar is a vascular emergency, not something to address casually. I'm here every week with life-saving information. Subscribe and I'll see you in the next video. Let me leave you with this final thought. Your circulation is the lifeline to every cell in your body. When circulation fails, tissues die. Feet are amputated. Vision is lost. Kidneys fail. Strokes occur. Minds deteriorate. All of this begins with damaged microvascular circulation caused by elevated blood sugar. The damage starts in prediabetes and accelerates in diabetes, but you have the power to stop it and, in many cases, reverse it. Every day that you maintain healthy blood sugar levels is a day that your blood vessels can heal. Every walk you take stimulates new vessel growth. Every nutritional intervention that reduces inflammation protects your endothelium. Your body wants to heal. You just need to give it the tools. So comment one of 3 things. Protecting my circulation now if you're committing to aggressive blood sugar control and vascular protection. Getting tested if you're going to have your circulation evaluated, or need help if you want guidance on where to start. Comment now. Protecting my circulation now, getting tested, or need help. Thank you for being here. Your circulation is your lifeline. Protect it fiercely. I'll see you in the next video.